One of the aspects that came across very strongly throughout my residency is dealing with the academic sector, education, the training, because I feel strongly that what we are doing is training professionals for the 20th century, not for the 21st century. Let me explain this. I'm a medical doctor. I was trained 40 years ago without having heard about the word geriatric medicine. Excusable, because I was in Brazil, a young country, and all the pressures and the focus was on childhood and infectious diseases and acute problems and so on. But now, 40 years later, with the longevity revolution, you look at the curricula of medical schools pretty well throughout the world, and you don't have an aging component there. I'm not talking about training geriatricians necessarily. We may need them because they will be those that have more knowledge about aging, and they will train the others. I'm talking about the future gastroenterologists, neurologists, cardiologists, you name it. Because the population is aging, they will have more and more and more patients that are aging. And because they haven't learned, they will make mistakes. These mistakes can be dear to their patients, including death. We have a word for this, iatrogenics. It comes from iatrus, from the doctor, the medical doctor, and genesis. It is caused by doctors. Well, this is one of the most important causes of death in older age. Why? Because these people, these doctors, nurses, physiotherapists, and so on, are not learning enough about aging. I'm not talking about only interaction of drugs in old age. I'm talking about anatomy. You know how difficult it is if you learn medicine and anatomy in an atlas that you turn the pages and it is an athlete, usually male, 23-year, peak of, all the muscles are there in order. And then you have to find the spleen in an obese old lady that is now 89. You won't find it. And this is what you have to learn from anatomy to physiology, the physiopathology, the interaction of medicines, the appropriate doses of that medicine that will not work in an 85-year-old person as it does in a 35-year-old one. But also the presentation of diseases. There are diseases that present themselves differently. A myocardial infarction in old age may not be painful at all. How can you recognize and treat it appropriately if you don't have that knowledge? So it is going to be critical that we look at the curricula and change. And because you have 3 universities, first-class universities, people can talk to each other. This is a small, relatively small place. They know each other. So let us encourage them to look at reform the curricula so that we, as a response, could have the Adelaide curriculum model for teaching medical students. This could have a huge impact worldwide. It's also important to think not only in terms of health professionals, because we need a city that is appropriate and responding to the longevity revolution, urban planners, architects, designers. You have issues that are emerging as very important, like elder abuse, neglect, abandon, wills. You need lawyers that will be more knowledgeable about aging and the complicated interactions within society, the family, the wills, heritage, all these aspects that are tricky. But if you are not trained about them, rights, we need people that will be knowledgeable about rights, because all the people, they don't have only needs, they have rights, and you have to respect them. Things like respecting dignity. How can you train a whole army of new professionals that will understand and have introjected this? We have done that, baby boomers, in relation to more respect to women. I'm sure that not everybody is paying that respect, but it is there. The knowledge is already a body of culture of knowledge that is present, that has been developed through the feminist movement. Now the aging movement is going to force that we also have the same respect to the dignity of older people. For no other reason, perhaps, because they themselves will be aging and will see that this respect is necessary, as women, through opening their eyes to the feminist movement, said, okay, enough. We are not going to be treated like that, and we are not going to allow you to treat me that way. That is the longevity revolution.